We begin this Tuesday evening with an update in the COVID-19 pandemic. The first cases of the COVID-19 Omicron variant have been confirmed here in Kern County. Public Health says 10 new variant cases were reported today, along with 324 new COVID-19 infections and no deaths, bringing the total number of confirmed cases to 166,183. And according to the U.S. Centers for Disease Control and Prevention, Omicron is the overwhelmingly dominant COVID-19 variant when it comes to new infections in the U.S. Their data shows the variant caused more than 95% of new COVID cases just last week. Now, 4 weeks ago, it accounted for just 8% of cases. The CDC notes not every COVID test sent out is tested to identify that specific variant. And with the arrival of Omicron in Kern County, public health officials are updating county supervisors with the plans in place to keep our health care system ready for another potential surge. 23 ABC's Brianna Willis breaks down the details of Kern County's preparation plans for an uptick of COVID variant cases.
As we have expected for the past couple of weeks, we have received our first batch of confirmed cases of Omicron here in Kern County, as we will report 10 cases of Omicron in Kern County today.
First Delta and now Omicron. The second COVID-19 variant of concern has officially been identified in Kern County as of Tuesday. And while 52% of Kern's eligible population is fully vaccinated, Brynn Carrigan, director of Kern County's Public Health Department, says the efficacy of the vaccine is slightly decreasing.
So as Omicron has emerged and is now actively transmitting, we're seeing that the immunity that's developed from these vaccines has waned enough so that transmission is occurring even amongst those that are vaccinated.
But Carrigan adds vaccines still help.
However, we are seeing that the vaccination, especially if you're boosted when you're eligible, is holding up against severe illness, hospitalization, and death.
Just 3 weeks ago, the Kern County case rate was 11.7%. Tuesday, the Kern County case rate now stands at 15.2%. And with this increase in cases, Carrigan says the county is preparing for the expected surge in cases and hospitalizations.
We currently have 2 state staff teams in Kern County that have expanded both regular and ICU hospital bed capacity at Kern Medical and at Adventist Health Bakersfield and Delano.
Carrigan says this adds 25 ICU beds and 15 regular hospital beds to Kern's capacity, and more help is on the way. Carrigan says 3 state staff strike teams should arrive by Monday to help 3 hospitals with ambulance and emergency room care. The assistance will remain in place until the end of February. Then Carrigan says the needs will be reassessed at that time, because as of right now, the state's modeling still shows a significant surge in early March.
The worst case scenario in the state's modeling suggests a significant surge peaking in March, with 986 cases on March 4th and 716 hospitalizations on March 11th.
With this modeling, Supervisor Mike Maggard ensuring Tuesday Kern County is prepared to care for the community.
Are you confident that we will continue to have adequate capacity to treat those who are gravely enough ill that they must go to the hospital?
Supervisor Maggard, through the chair, if we follow along with what the projections have indicated, the state's modeling has indicated, we will well exceed our capacity to be able to care for those that need hospitalization.
In Bakersfield, Brianna Willis, 23 ABC News, connecting you.
And Carrigan adds that the county is also seeing a significant number of people that are gravely ill that don't have COVID-19, so they are doing their best to prepare for whatever comes their way.